Good evening, everybody, and thank you for joining us for this first meeting of Staffing Matters and Urgency Committee. And it's Monday, the 26th of June. And the first job that we have on hand, I believe, is to elect a vice chair for the committee. So I'd like to nominate Councillor Coulbain. Is anybody happy to second Councillor Coulbain? Yeah, thank you. So are we happy with that nomination? Everybody in favour? Yeah, thank you. So Councillor Coulbain be vice chair of the committee moving forward. Thanks, everybody. Right, we have no apologies this evening. Everybody is present. And the declarations of interest. Does anybody have any declarations of interest? No? No. No declarations of interest. Just a reminder to use your microphone if you're speaking, Councillor, so everybody catches everything. No declarations of interest noted. A second item is the minutes, which were from the meeting on the 20th of March 2023. And I think Councillor Widdowson and I were were you there, Councillor Widdowson? I was, I know that for sure. No, just me. Okay, well, I can assure you that it's a fair reflection of the meeting. So can we accept those minutes then, everybody? Yeah, thanks. Third item is public participation. We have nobody registered to speak in public participation. So we'll move on to item 4, which is the appointment of public health roles and temporary arrangements. And Helen Whiting is going to introduce that item for us. Thank you. Oh, sorry, apologies. No. Ian Floyd is going to introduce that.
Yeah, I'll just say a brief introduction, then Helen will take you through a bit more of detail. So obviously this is just looking at the 2 key roles in public health, the Director Public Health and the Assistant Director Public Health. Members probably aware the Assistant Director left fairly recently. In respect of the Director of Public Health, they have indicated that they intend to take retirement at the end of this financial year, sorry, at the end of this calendar year. And so we have to move in terms of the appointment of both of those roles, because clearly both of them, one is empty at the moment and one will become empty at the end of this year. The other issue which the report takes you through is that the current Director of Public Health is also away from the office, sick at this point in time. And we need to have in place arrangements for any period where they are away, and clearly they may return, clearly. But whilst they are absent, sick, we do need to put arrangements in place for that. And so the report takes you through that in terms of an acting up type of arrangement. There are some issues, particularly when we get onto the 2 roles in terms of their recruitment, because they're both public health roles. There are some issues in terms of the process we need to go, which is slightly different from normal chief officer appointments, but Helen will take you through some of that.
Okay, thank you, Ian. So yeah, approval is sought to fill both of these vacancies on a like-for-like basis, and to actually do that, certainly with the Director of Public Health and the Public Health Assistant, it's required that we actually go through the Regional Director of Public Health to confirm the job description and also the appointment. So they will actually sit on the appointments panel as well alongside members, because it is a member's appointment. And what we will actually do is make sure that there's all the faculty, and then it also has to go to a faculty assurer to make sure that the appointment is appropriate. And that would also be for the interim role. So we're making arrangements, should this be all authorised, for any interim role that we put in place, they have to actually be authorised as well, to ensure that they have the right qualifications, but also what they call in their regulations good standing. So that will all be approved through the relevant processes as well. In terms of the recruitment, we will aim to recruit as quickly as possible with your approval to take it forward. And we would hope that if we can get that out kind of beginning of July, mid-July, we would look for a recruitment for the Director of Public Health, likely around December, January, by the time we've taken into account notice periods, etc. However, we would hope that we've got that interim arrangement in place, either our existing Director of Public Health up till December when she retires, or an interim arrangement as well. And when we're talking about the interim arrangements, we wouldn't obviously have an interim arrangement and our Director of Public Health if she returns to work. So it's about just making sure that we've got that covered, because it's a statutory requirement that we always have somebody in work, even if the Director of Public Health is absent from work in holidays. We still have provision and there's always somebody available. In terms of our workforce, there is only one person who is qualified, because they must also have a qualification. There is only one qualification there that we can actually accept. So that's why that's why our interim arrangements are quite narrow, but we feel that we can cover it and have a sustainable public health function as well going forward. So, and I'm happy to take any questions.
Thank you, Helen. Does anybody have any questions for Helen at all? Councillor Eyre?
Thank you, Chair. Paragraph 17, but also I think towards the finance section, it mentions the Director of Public Health salary as well as the on-cost increase. Now, when we first appointed Director of Public Health, there were additional payments made due to certain NHS qualifications. Is that?
We don't need to do that. We'll be appointed tonight. Sorry, that's because they transferred. There will be CYC employees, so they'll be on our director grade. So going forward.
Well, I must have the
one I think you are thinking about dates back to when public health function transferred into local government, who isn't the current post holder. The one at the time, and I forget exactly when, but I think it was sort of 2014, 15, that sort of period. The one who came from the health service, he did have additional enhancements, which were quite significant, which meant that actually the payment was significantly more than actually the chief officer's salary. That's not the case with this one and won't be the case with others. It just related to the transfer from the NHS of that particular individual transferring into local government.
That'll have been Chupi.
Yeah.
Chupi, yeah.
Thank you. Any other questions at all? Anybody? Councillor Widdowson?
Is there any way of, do we have to have the two people here for the council to operate? Or is there any way that we can have an agreement with any other local council so that there is always cover available? I'm just thinking about in the interim arrangements or going forwards, do we need two bodies here? Or can there be a pool? You said the regional health area. Is there something that can be done there?
We have explored that, and there is a potential for, we've explored with North Yorkshire and a couple of other authorities, but there wasn't the appetite there to take that forward or the capacity to take that forward. So we are looking internally to be able to fulfil that here. So I'm taking it forward. I don't know whether, because Ian, you had the conversation.
Yeah, I think different aspects there in terms of the bit about, do you need them day-to-day service and that, but then also what do you do if there's a bigger issue? Now, clearly we cooperated a lot during COVID, so particularly with North Yorkshire. And so we have what's known as a local resilience forum. So any major issue, any emergency, we will work together regionally. And certainly that was the case with public health. I think though there is also an important issue, which is it's very important, I think, to very much have your own people sometimes, and we saw the benefit of that during COVID in terms of the fact that each area is very different, distinct, they've got their own issues. So we have looked at it. I mean, like any service, there's always a different way of doing it. It comes down to choice, doesn't it? And I think the having these two roles certainly doesn't put us out of kilter in terms of, if you look at comparisons in terms of what would be expected in terms of a level of resource who have got the qualification, which Helen referred to. So at the moment, we have 2.5 people who've got that. That's broadly in line. That's not out of kilter in terms of it. So I think it gives us a strong service. It gives a good service, which will, you know, allow the council to very much have public health at the heart of lots of things that it does. We are fortunate, you know, the team and the service is very good, well respected. Every service, you could always, you could reduce it, but you simply wouldn't get the same level of service. That's the reality.
Councillor Eyre?
Thank you, Chair. Just to follow on from that one, I think, is in terms of combined authorities, is there a precedent from combined authorities elsewhere where they've had a single DPH for the combined authority?
Not in the combined authorities, as far as I'm aware. That's not a function that's come up. It's been more place-based, as far as I know.
Yeah, not so much public health. They have, and it's an option for us in terms of your emergency planning teams. I think there's opportunity to do that regionally in terms of resilience. I'm not aware of anybody who has done that to the combined authority for public health. It's possible that Greater Manchester might have had because they got a lot of health functions in their deal, so they may have done something, but I'm not aware of it.
Councillor Widdowson?
Just following up on, there was no appetite in North Yorkshire for this. Could you just give me a little bit more detail on that? Because I'm aware that we've had previous conversations where we thought we only need 1.5 of these types of bodies and we could go through different arrangements. And it might therefore be easier to recruit or cover or whatever else.
Yeah, I mean, I can go into that without going into, you know, the specific details of the conversation. That is North Yorkshire Council, which is a new council. They have got a lot of issues in terms of just creating that new council. And I think, you know, their broad priority lies in actually getting their new council functioning well and effective. You know, it's like anything, isn't it? As an organisation, there's only so much change you can deal with. So I get the impression they're not looking at this stage for major sort of partnership sharing arrangements. The time may happen in the future where we can reconsider that. I think we also though need to recognise, you know, where we are as a council. Many of the things which certainly, you know, new administration want to deliver have public health at the heart of what they want to do. We need a structure that responds to that. And I think, yeah, there's not a service, generally speaking, that you couldn't find where, you know, can you deliver it with 3 or can you deliver it with 2? I'd go back to answer, yes, you can deliver it with 2. You'll just get less. You'll get less from that service.
Thank you. Anybody else for any other questions at all? No? Okay. And can you just confirm for me that the public health budget is ring-fenced for that specific issue for that particular department and is part of the broader council, but is not part of the broad budget of the council? Thanks.
Yeah, you get a specific grant for public health. You have to demonstrate that you've used that grant on public health purposes. So we always have to submit a return which says we've used it on that basis. There is, you know, there's some grey areas between it. I suspect we spend more. If you really wanted to work through it, we spend probably more. But yeah, it is ring fence. You have to demonstrate you've spent it on public health. You couldn't say we've only spent half of it and we've used the other half on, you know, children's services, for example.
Thank you. Thanks for that. Right. Okay, then. So the recommendations are on page 6 and 7. Unless somebody tells me otherwise, I propose that we take them in bulk. So there's recommendation 7A, B, C, D and E, which is the approval to move ahead with the recruitment process confirm the pay package, and then engaging the North Yorkshire County Council resourcing team to move forward with the recruitment as well. So can I see all those that are in favour of the recommendations, please? Can I see those that are against the recommendations?
Sorry, Chair, I thought you were going to open it to debate. Well, the questions.
Oh, I'm sorry.
Sorry.
I'm sorry, apologies.
It was just to summarise our position more than.
Okay, please go ahead.
I think so. It won't surprise Helen to know that we actually weren't keen to recruit to these two specific posts. I think paragraph 5 sums it up in terms of the need that we had agreed to a senior management restructure, and I think these particular roles should be part of that senior management restructure. Absolutely believe this money should be spent on public health. I think actually there is money to be saved across those two posts, which would allow more funding to be invested at the lower levels of public health in terms of prevention, early intervention, and the work that we need to do across public health. So our view would be that we wouldn't go to those to recruit those two specific posts pending any senior officer review.
Okay, thank you, Councillor. Yeah, and I think that's where we differ, doesn't it? Our view and understanding of the data and the health inequalities that are in the city have led us to the position that we think that the Director of Public Health and Deputy Director are very important roles that will allow us to get the best outcome out of our public health department for the city of York and for all residents, and particularly those that are most heavily affected by health inequalities in the city. And because of the fact that the budget is ring-fenced, that although there may be some view of restructuring around certain areas of the organisation, that public health can sit without that. Does anybody else want to make any other comment? Councillor Widdowson?
Could I just check just one thing about the ring-fenced budget? It's ring-fenced for public health spending, not for the salaries, isn't it? It's ring-fenced for all of the activity in that area, and we already, within the council, we've already always spent more than that ring-fenced budget on public health. Am I correct?
We have to just simply account for the fact that we get a grant, and I forget exactly how much it is, but it's about 8 million, something of that order. We have to account for the fact that that has been spent on public health. We also have to ensure that the structure in terms of the people who've got the qualification to act is sufficient and that is broadly accepted by the sort of regional public health bodies as well. But yeah, you have to account for that £8 million or so of spend. You don't have to, it doesn't tell you precisely where you need to spend that.
Right, anybody else for any other comments? Or can we move to the recommendations then? So as I've said earlier, they're on page 6 and 7. Can I see those in favour of the recommendations? I see those against the recommendations. Okay, so I have the deciding vote, and I will vote in favour of the recommendations so we can move ahead with them. Thank you. Right, so the next item on the agenda is the work plan. Does anybody have any comments at all, thoughts on the proposal for 4th of September meeting? Anything in addition that needs to go on there? Anybody? No, not at this point in time. Helen? No. Okay, thank you. So the work plan looks like it's in order. And then our final item 6 is urgent business. I've not been made aware of any urgent business. So that brings our meeting to a close, and thank you for everybody for joining us, and we will see you next time. Thanks.